by our associate, Dr. Anderson, who is a part of our practice. We're going to let you know what's going on with children's health when it comes to healing the allergic triad. So that's what eczema, asthma, and allergies are often called. So in all three conditions, the body has an allergic reaction that's triggered by the overproduction of histamine. Normally, histamine, a chemical compound produced by immune cells, aids in digestion, the sleep-wake cycle, and in cuing inflammation to fight infections. So the good news is not only can naturopathic medicine work as well or better, our naturopathic remedies can spare children from needing stronger and more problematic drugs as they get older. So Dr. Anderson, let's start with letting our viewers know the kind of symptoms that are typical with the allergic triad.
Great question. The allergic triad, as you mentioned, eczema, asthma, and allergic rhinitis, often shows up early in life and can evolve over time. It typically follows a progression known as the atopic march, starting with eczema in infancy, followed by allergies, and later asthma. With eczema, we see dry, itchy, inflamed skin, often behind the knees, elbows, or on the cheeks in infants especially. With asthma, children may experience wheezing, shortness of breath, or nighttime coughing or nighttime symptoms. And with allergies, symptoms include a runny nose, sneezing, congestion, and itchy eyes.
Yeah.
What's important is that these aren't isolated conditions. They're often connected expressions of an overactive immune response.
Yeah. And I mean, really too often parents aren't informed about the reasons, that their children have eczema or allergies or asthma. So
Right.
can you just kind of share or explain a little bit with us about what's actually going on in the body, like when this is happening in a child?
Sure. So at the root, we're looking at immune dysregulation. Research shows that many of these kiddos have a dominance of what we call a Th2 immune response, which drives allergic inflammation and that histamine release. So we also commonly I see in my practice, and we see it in the research too, increased intestinal permeability or leaky gut, imbalances in the gut microbiome, and impaired skin barrier function. So instead of responding appropriately, the immune system becomes hypersensitive to foods, pollen, or environmental triggers.
Mm-hmm. Yeah, so it's really like overreacting, right? To these
Yes.
things and these triggers. And so now let's just turn to the way that regular medicine treats eczema or asthma or allergies. So I know we've seen a lot of these children in our practice, right? And I would say the common thing that I really hear from a lot of these parents is just that, okay, there's this treatment, but then after I stop the treatment, then the symptoms just come back and they can get worse over time. And so I think there's a reason, why a lot of families are really coming to us and looking for answers, But can you just talk a little bit about the way that regular medicine typically treats these conditions and their typical treatment protocols?
Yep. And conventional medicine tends to focus on symptom management. These, asthma can be a life-threatening condition, and you do need to know how to manage it in an acute situation, which is, why I like having the deep knowledge of both the Eastern and Western medicine.
Mm-hmm. Yeah.
But treatments, the Western treatments typically include the topical steroids for eczema, antihistamines for allergy, things like Benadryl or Claritin, asthma, like a rescue inhaler, albuterol, for example, or even a daily steroid inhaler. A lot of these kiddos end up taking for control of their symptoms. These can be effective in the short term and for acute cases, like I said, but they don't address the underlying immune balance that we keep talking about that's driven by these, the gut microbiome being off, or, toxicities in the body, environmental triggers. So over time, what'll happen with these kids, and this is part of the reason we call it the atopic march, because if we don't get to those root causes, they're just going to keep marching along and requiring more medications and and acquiring more sensitivities. It's not
Mhm.
normal just to like become more and more allergic to things as you get older.
Mhm. Mhm. Yeah.
So, and with these medications, they all come with, some degree of a potential side effect,
Right.
especially when taken over the long term and
Right.
during growth and development significantly. So,
Yeah. And so next we're going to kind of talk about the way naturopathic medicine treats the allergic triad. But first, when just talking to our patients, when it really comes to the best treatment, it's really important to emphasize that everyone has a different makeup, so each person needs individually tailored medical solutions. And so you can call our office to schedule a no-charge medical consultation with me so I can talk with you personally about your health concerns. Our phone and other contact information is on our Facebook page. And if you purchase vitamins, minerals, supplements, herbs, and such, please visit our online supplement store, which is on our website at drtaketa-wong.com. That's drtaketa-wong.com. There's a 20% discount store-wide. You can trust the products, and all the net proceeds go to helping children with special needs with their medical treatment. So a link is in the post with this video. So I know we talked about that, for a lot of these children, there can be a lot of side effects, right? With the medications. I know that a lot of the the topical steroid creams can thin the skin. And a lot of parents say that after their child after they stop it, a lot of times the eczema will just like come right back and it'll many times be like even worse than before, right?
Dependence. Yep.
Yeah.
Dependence and withdrawal.
Right. And steroids, if oral steroids are used in children especially, that can really affect their growth, their development. And also, a lot of these medications, they're trying to suppress the immune system, right? So the immune system is kind of overactive. So they're trying to like suppress the immune system to knock down the inflammation, which is helpful in the short term, right? But that it also will suppress the immune system so that they're more, with a lot of these oral medications or stronger and stronger medications, it's like as they continue to take it long term, it can really suppress the immune system and can make them more susceptible to infections. And some of these medications even have risks of like certain types of cancers, because you're really, again, suppressing the natural immune system's ability to fight off things, which actually does include cancer. Everyone can have cancer risks. And so, when you don't have your normal immune system is kind of policing to make sure that even cancer cells are kind of kept in check, then there is a risk factor for cancer too, and that's super scary for anyone, but especially for a parent of a child.
Yep.
Right.
Yeah. Everyone knows about defense, but they don't think about surveillance.
Right.
And that's really what the immune system does, is surveils for cancer cells and atypical cells.
Right. Yeah.
So what I always tell people is these meds, they are great. They work. Steroids, immunosuppressive drugs, they work, but they do not come without side effects, and some pretty serious in some cases.
Yeah. And, so when it comes to naturopathic medicine, it's really about identifying the underlying causes of things and really just going beyond just like suppressing the symptoms to really treating the root, right, of what's going on. So, and I know you often will start with a healing food plan that's tailored to each individual child, to further treat symptoms and promote overall strengthening. We may also prescribe medical grade natural remedies. These are laboratory tested, health promoting supplements, vitamins, minerals, herbs, peptides, low dose immunotherapy, and other healing remedies from the US and all over the world. So can you just let our viewers know about more of the naturopathic approach to treating these conditions?
Yeah, most of my eczema, allergy, asthma patients, I'm going to have a very similar approach. We're going to look at their allergic load overall, and create, so that includes things they're ingesting and things that they're inhaling, things in their environment. So looking at things like mold, looking at known and unknown food allergies, food sensitivities, maybe doing some testing, maybe not, maybe just removing based on what we know are really common food sensitivities like wheat and dairy, or getting really, really specific about it and doing some testing and removing those foods. So yeah, the personalized nutrition plan. And it's not only going to be food sensitivities and allergies, but it's also going to be looking to plug these nutrient deficiencies that are often caused by gut imbalances. So, absorption of things like iron, for example, that's significantly affected if you have gut imbalances. And what do I even mean by that? So that's the other thing we're always going to look into and treat either based on symptoms or testing. We'll look into, is there overgrowth of undesirable bugs in the gut? Things like bad bacteria or yeast, for example, that can be driving the inflammation in the gut, that makes this a systemic problem. That takes this from being just a problem in their gut to being a systemic problem that looks like eczema or allergies or asthma. So I think with all of those targeted nutrients, with these patients, we're always going to be doing fish oils, some combination of omega-3 fatty acids for anti-inflammatory, vitamin D, and then natural antihistamines like quercetin and nettles, doing probiotics if indicated, and then gut healing protocols. I do not work with a patient where we're not doing some sort of healing, intense healing of the gut. It doesn't always have to be intense, but we're really looking deep into all the aspects of the microbiome and inflammation in the gut. So the goal is not, and one thing I do want to mention is just because we're always looking to treat the root cause does not mean that we cannot also treat acute symptoms with natural medicine.
Yeah.
So, right, like after that first visit, we're going to start some natural stuff that's going to hopefully start to take the place of all of those pharmaceuticals that are needing to be used daily, in an effort to control symptoms in the acute too with more natural remedies, because the healing takes time. You know what I mean? That's going to happen over time. So the goal is not just symptom relief, although we can absolutely provide that. It's long-term immune resiliency and teaching and re-educating the immune system to have an appropriate response to its environment, and to things that, your kiddo's consuming. And one of the great things I do want to mention is with our approaches, we do see over and over again healing, not always 100%, but to some degree healing or some sort of desensitization to these various allergens and sensitivities once you treat the internal terrain.
Yeah.
Another thing that we often look at with these patients, especially in Hawaii, is are there things inside the body, like maybe mold, for example, that could be increasing production of histamine? So trying to identify those things and treat those as well.
Yeah, and that's a really common thing. I think it's much more common than people
Super.
realize,
Oh yeah.
that mold toxins or things like that, it's not just you get a sniffly nose. The mold toxins can really trigger tons of inflammation, make the immune system overreactive, where then you have an immune system that is like super overreactive. And I know we've seen lots of patients who've been able to get out of a moldy environment or detoxed, and then it's like they used to have all these allergies to like tons of foods and tons of everything, pollen and grass and dog dander and stuff, and then they get out of the moldy environment or we detox them, and then they don't have those reactions anymore. So it's like pretty
so I
amazing.
always one little I guess pro tip would be, if you suspect that you might be experiencing mold or your child is exposed or whoever, if you go to an environment that's not moist and potentially moldy and you notice improvement in your symptoms, that could be, that it's not confirmatory, but could definitely be a key that something is going on there with mold or something else in your environment, potentially.
Yeah. And I know you've treated many, many children with eczema, asthma, and allergies. So can you give our viewers just a few examples of what you've seen with working with these patients?
Yeah, well, I wanted to share one that always comes to mind when people ask me for, cases of eczema kiddos, because this particular kid, he had one of the most severe cases of eczema I had ever seen. He was, really head to toe, and he was incredibly uncomfortable. He was 4, and he was not sleeping, which meant the rest of the family was also not sleeping, and he was also really uncomfortable during the day. And we did the typical, approach, and that definitely did help. But it still seemed like, a lot of times we'll do these things and it'll get you 50% of the way there or 70% of the way there, but there's still some symptoms sticking around. So we had to do some further investigation. So after doing like removal of the common food sensitivities like dairy and gluten, doing the stool testing to identify he had candida and treating that, he had bacterial overgrowth, treating that, addressing his nutrient deficiencies, low vitamin D, low iron, low magnesium. This all helped, but it didn't fully resolve his symptoms. So we carried on. We're always going to keep, right? I always tell my patients, it's like, we're never going to stop like turning over the rocks and looking in the nooks and crannies and trying to figure out what is happening. And so we ended up determining he was actually allergic to nickel. And a lot of people don't realize that there's nickel in foods, not just topical nickel, like the metal, being allergic to jewelry or something like that. So it was random. Nobody could really pinpoint. So once we removed the nickel from his diet, which was a very specific set of foods, his itching completely went away. And so I don't think that removing the nickel alone would have healed him had we not done all of the other stuff. But it's more the approach of, like an investigator. That's how I approach cases, and I know you do in a similar way too. You're going to keep investigating, you're going to keep looking for all those root causes until we can get a person as close to healed as possible. And especially with kids, because I've seen it happen so many times. You don't have to just assume that, okay, this is life. Now they have to know all they can eat is sweet potatoes and broccoli and blueberries and chicken forever.
Right.
Because there's kids that come, and I know you've had those kids too, that they are literally on that, not because they're picky, but because they're just that sensitive to so many different things. So it's really, really rewarding, and it can be tough. Eczema is not an easy thing to treat, but when you get them to the other side and get them able to tolerate foods they weren't able to eat for a long time without having reactions, it can be really rewarding. And just to get them sleeping and not so uncomfortable.
Because it's just, these things can really affect them, and asthma can be life-threatening, so it's just, so I really want to thank you, Dr. Anderson, for all your wisdom and skill and explaining how we treat children with eczema, asthma, and allergies. So for our viewers, I trust our discussion about the allergic triad has been valuable for you. With our no-charge medical consultation, you're welcome to talk with me personally about any health concerns that you have so that you too can be empowered with your health. And if you're wanting to see Dr. Anderson, again, because she's part of our practice, then that would be the first step, is getting in touch with our office, and then we have that no-charge consultation to see if it's the right fit. And all the contact information, as I mentioned, is on our Facebook page. If you purchase vitamins, minerals, herbs, and such, please visit our online supplement store, which is again on our website at drtaketa-wong.com. There's a 20% discount store-wide. You can trust the products, and all the net proceeds go to helping children with special needs with their medical treatment. And a link is in the post with this video. So mahalo, and we look forward to seeing you again in 2 weeks. So aloha.
Aloha.